What is raspberry leaf tea? Raspberries are popular red berries that are native to Europe and parts of Asia. It's the leaf of the plant that is used to make the herbal tea of the same name. Raspberry leaf tea has been used over many years to treat certain ailments and to facilitate labor and childbirth. However, evidence for its benefits is weak and more research is needed to assess its efficacy. The tea can be purchased loose as leaves, in tea bags or in tablet form. Alternatively, you can make your own infusion using dried raspberry leaves. The astringency of the leaves produces a tea similar in taste to black tea, although commercial blends often combine the leaf with a sweeter tasting herb, such as peppermint. To make raspberry leaf tea, bring water to the boil in a small pan and allow to cool slightly. Add 2 tablespoons dried raspberry leaves, cover and steep for 15 to 30 minutes. Strain and sweeten to taste. If you wish to collect leaves to dry, they should be collected during or shortly after the plant has flowered. Discover our full range of health benefit guides and read more about the profile of other teas in our series, including the health benefits of green tea, ginger tea, peppermint tea, chamomile tea, and Rubus tea. Nutritional benefits of raspberry leaf tea. Raspberry leaves contain B group vitamins and vitamins C and E, as well as the minerals calcium, magnesium, and zinc. The leaves are also a source of protective plant compounds such as bioflavonoids and tannins. The herbal infusion is caffeine-free. Raspberries on a bush. Top 9 health benefits of raspberry leaf tea. 1. A source of protective antioxidants. Plant compounds called polyphenols are known to protect the body against disease. They also make an important contribution towards a healthy, balanced diet. Raspberry leaves contain antioxidizing polyphenols, namely, tannins, bioflavonoids and alkaloids. It's the latter that are said to tone and relax the pelvic and uterine muscles. Despite lower levels of polyphenols than green or black tea, those of raspberry leaf tea are on a par with fruit drinks and white wine. 2. Digestive support. Taken to support indigestion, bloating and diarrhea, raspberry leaf tea may provide some relief. The tea is thought to have a mild diuretic effect which may help reduce the bloating associated with fluid retention. 3. Relieves mouth ulcers, sore throats, and gum disease. Used as a mouthwash, this astringent tea may relieve the discomfort of mouth ulcers, sore throats, and gum disease. 4. Alleviates inflammatory conditions. Historically, an infusion of raspberry leaf has been used as an eye wash for inflammatory eye conditions such as conjunctivitis. It has also been used topically to ease the irritation of skin rashes. 5. Menstrual cramping and water retention. Raspberry leaf contains fragrine, which helps tone and tighten the muscles in the pelvic area. As a result, it may be beneficial in reducing mild period cramping. Research is scant but a long history of anecdotal reports appear to support the tea's use easing cramps. The infusion is also believed to have a mild diuretic effect and may reduce the puffiness associated with water retention during menstruation and pregnancy. 6. May support late stage of pregnancy. A popular choice during pregnancy, raspberry leaf is thought to strengthen and tone the uterus and thus potentially facilitate labor. Evidence for its safe use is weak and more research is needed to assess the leaf's effectiveness. Taken as a daily tea from about week 32 of pregnancy, it is thought to prime the uterus by increasing blood flow and toning the uterine muscles. However, mums-to-be should avoid consumption too early in their pregnancy and too close to their due date. 7. Morning sickness. Anecdotal reports suggest that raspberry leaf tea may help ease morning sickness. However, as symptoms of pregnancy nausea typically occur in early pregnancy and ease by the second trimester, it's advisable to check with your midwife or GP before consuming the tea. Raspberry leaf tea is not recommended during the early stages of pregnancy. 8. Assists during childbirth. Some studies suggest that raspberry leaf tea may help improve labor outcomes and reduce the need for medical interventions, such as C-section or a forceps delivery. This may be attributed to the increased tone and improved functionality of the uterine muscle. 9. Perimenopausal menstrual flow. Although raspberry leaf tea hasn't been specifically linked to the alleviation of perimenopausal symptoms, it may help lessen heavy menstrual flow and cramping. Is raspberry leaf tea safe for everyone? For most healthy adults, raspberry leaf tea appears to be a safe, mild herb when consumed in modest amounts of 1 to 3 cups per day. However, it is not recommended for children or young people under the age of 18 years. The European Medicines Agency supports the use of the tea as a medicine for the relief of mild period cramps, mouth or throat inflammation and diarrhea. Although insufficient evidence from clinical trials is available to support the EMA's findings, they arrived at their conclusion based on the traditional use of the herb over 30 or more years. And, while clinical studies have not found a higher incidence of adverse pregnancy outcomes, there remains insufficient evidence to support its efficacy and safety for pregnant women. That said, raspberry leaf tea continues to be a popular pregnancy choice and has a long history of use. Nevertheless, be advised that if you're pregnant and meet any one of the following criteria, it is best that you avoid drinking raspberry leaf tea. Have health complications such as high blood pressure or gestational diabetes. Are expecting a breech birth. Are close to your due date. Have had a previous short labor of 3 hours or less. Have had a previous premature birth. Have a planned C-section or have had a previous C-section. Are expecting twins. Have experienced bleeding in the second half of your pregnancy. The tea should also be avoided by those who have a family history of breast or ovarian cancer, endometriosis, or fibroids. Other side effects that may be experienced include a mild diuretic or laxative effect. A few final thoughts. Although commonly used for centuries, there is still relatively little known about exactly how the active compounds in raspberry leaf tea work. Any beneficial effects are believed to depend on the herbal preparation used and the stage of pregnancy at which it is taken. If you are pregnant and considering raspberry leaf tea, speak with your midwife, doula, or GP before drinking the infusion or taking raspberry leaf capsules.